Hi, everybody. This is Andrew Lau. I'm actually doing a webinar today for our pre-diabetic and diabetic customer clients to give them some idea how to lower the stress. Hi， 我係 Andrew Lau 啊。其實我哋亦都有 Facebook Live 嘅喺Facebook 嗰度啦。So 你可以睇下試下 Facebook 睇唔睇到？咁但係今日好特別咧，因為好多朋友咧，堂友都話俾我聽咧，就話俾我聽，哇，you know 我哋好多人都覺得好 stress， 咁點能夠令到我哋唔夠 stress 咧？咁呢個咧係一個即係我覺得喺我哋方面咧，如果可以俾啲 tips 佢哋咧，咁令到佢能夠唔會將個 stress 整高咗，然後另咗一樣嘢咧，令到佢更加會血糖都高埋啦。咁所以咧今日嘅 webinar 咧，我諗對大家都好有幫助嘅。You know, today our webinar is actually can be very helpful. So I want to see my Hawaii friend. We have a lot of people from Hawaii, Hong Kong, Singapore. Can you give me a one response? At least I know that you can hear me clearly. So put one on the on your chat, and so I know you can hear me. Okay, good. Thanks, Eugene. Hear from you guys. How about other people? Can you get me some more? Like, Pat, can you just put a one inside so I know you are here? Okay, thank you. Thanks, Wilson. And okay, we have people from Hawaii can hear me, from Hong Kong hear me. 好多謝各位朋友，即係香港嘅睇到我，Hawaii又睇到我，新加坡又睇到我，哇，好正。OK, very good。咁我哋而家開始我哋個 webinar 啦。咁其實咧，呢個今日咧係一個特別啲 webinar 啦。So we will start this webinar now. And we'll go from there. So let me share my screen. OK，大家睇到個 screen， 如果睇到個 screen 咧，俾個再俾到一段啦。Can you hear me okay, everybody? Okay. How about now? Is it clear? Can you hear me all right? Is it loud enough, everybody? Can you hear me? If you hear me, say yes. Okay, good. Everybody hear me. Now, can you see the screen good? If everybody hear me, see the screen's good, can you also give me a one, the screen? Give me a one. So that way, or give me a one if you hear, see the screen good. Okay, good. Excellent. All right. What we're going to talk about today is 6 tips to lower your stress for pre-diabetic and diabetic clients. And also after that, after our webinar content, we will talk about how to make a very delicious chocolate shuffle. And that's really unique because I tried all the recipe and people say, wow, this is really good. And actually, people actually ate it and love it. 嗱，今日好特別咧，我哋會講下6個 tips， 乜嘢嘅能夠令到我哋嘅糖友啦，或者前期患病嘅糖友啦，能夠佢降低佢嘅壓力。因為咧，原來壓力係對我哋嘅糖友係一個好大嘅影響嘅。咁今日你會講樣嘢，繼續咧，我亦都教你點做一個 waffle， 但係呢個唔係叫 waffle， 叫 shuffle。點解咧 shuffle 咧？就因為咧 shuffle 係用雞蛋同埋呢個 cheese 嚟做嘅，就唔係我哋 typically 咧用啲麵粉嚟做。咁你個 carbs 咧係得2個 gram carbs 嘅啫。咁 it's going to be very good. So the carbs you're going to get out from the shuffle is only 2 grams. And I tried it myself. It's delicious. I have not only diabetic people try it, undiabetic, you know, my wife, my children tried it. They said, wow, that is a very good recipe. Okay, also we start going now. Okay, so let me, okay. Now I'm going to just spend 2 minutes for people who are new to catch up because I have about maybe 20, 30 people are new. So I need to give them some idea to catch up with the previous lecture, but it's only 2 slides. Anyway, you got to understand, if you are diabetic or eventually you become pre-diabetic, you know what? Your whole body will be affected. You know, this is really sad because a lot of people don't realize the whole body, you can be affected by your typical, you know, diabetic. So net result of that can be detrimental for your health because you know, if your whole body affected, it can affect everything, and later on we'll talk a little bit about it. So the most important is control your blood sugar. And how do you control that? Okay, 嗱，如果你係依家係糖友，或者你前期患病嘅糖友，好重要嘅問題咧，就係你依個糖咧係會影響你成個身體嘅健康嘅。咁咩叫全個身體健康啊？咁你原來咧又有血糖係會影響所有嘅 vessel 嘅喎。咁所以其實咧係一個好大嘅問題嘅。咁所以變咗嚟講咧，你係應該要即係注重咧係點能夠控制呢個糖。咁如果控制到個糖咧，咁其他嘅後患症咧都係會降低嘅。咁嗱，咩叫控制糖啊 ？So let me ask, what is you how to control your sugar？其實 sugar 咧 control 咧最緊要係喺呢個 diet 嗰度啦，或者喺你 exercise 度啦，仲要呢個控制你個 weight 啦。咁呢啲全部咧係能夠控制到血糖嘅。So how do you do to control your sugar? Now, certainly it's so important. One, you have to control your diet. I mean, that's the big one of it. You know, the diet is so important. Secondly, your exercise to control. With exercise, you burn off some of your fat, some of your calories, and that will lower your blood sugar and also decrease your insulin resistance. The big thing is called insulin resistance. So when you control that, you will become a tremendous, better, lower your blood sugar. And then we have a few other things. So you have to continue monitor. How do you monitor? It has to be blood checking. And then certainly with that, you increase your doctor seminar knowledge, so you get more and more understanding what you need to do. And certainly also, really at the end of the day, when you notify you are a diabetic or you are pre-diabetic, you really have to start changing your lifestyle. And changing your lifestyle, really at the end of the day, the diet change, anything is called white powder. You cannot really need to eat at all. What is the white powder? Like rice, flour, anything with bread, even with white bread, all those has to cut off. Or, a lot of time people don't realize a piece of white bread is actually 13 carbs. So that is very, very high in carbs. So you need to change that also. So that is a tremendous, change in your lifestyle in many people. And then you have to start doing exercise. You have to walk around. You have to, start managing your weight. Now, all that is considered a lifestyle change. So if you got that information, you are being a diabetic or pre-diabetic, you need to start doing all that. Okay? 嗱，如果你一知道你自己係糖尿患病者、糖友或者前期患病者，咁你咧就好多機會咧就真係要轉咗你整體個成個叫改變咗個生活啦個 lifestyle。咁你轉 lifestyle 咩嘅咧？就係你個 diet 啦，所謂白粉唔食得啦。白粉咩叫白粉啊？白粉就係好似你白砂糖啊、麵粉啊、飯啊，食少啲啦。如果你唔食唔到就食少啲啦。呢啲係全部係高 carb， 令到你增加你個blood sugar 嘅。咁當你如果係能夠控制到呢個咧，咁你就可以能夠將你血糖降低。咁呢個咧係一個好大嘅所謂叫生活嘅改變啦。好多人話嗱，仲有你又要 exercise 啦，有啲人話好老喎，唔 exercise，咁你可唔可以行咧？一樣得咁係咪？咁身邊人嚟講咧，呢啲咁嘅嘢咧，你都要開始自己去轉變咗出嚟，能夠令到你咧係幫助你咧係改變咗你個血糖嘅高度啦。咁同埋你又要 track 你血糖，篤手指啦，或者有機去度啦。咁飲嘢點樣啊？How do you control your drinks? Actually, all the soda water like Coke, even Diet Coke, okay, you have no sugar, but it fool your brain. It says I need sugar after that, so you have to cut that off. So certainly we have a tea called Lowsutea tea, will help you to lower your blood sugar. And the very interesting thing is more and more people start realizing. If you are pre-diabetic, the doctor will not give you any medication because you are not there yet. So all they have to do is say, hey, you don't need any sweet. And a lot of people don't understand that. So they just keep the same lifestyle. They haven't done much. And net result, wow, that's really sad because later on, what happened to them is they will continue, Sorry, I just have some technical issue that I need to figure out how to get back onto the screen. Hold on. Okay. Oh. Okay, can everybody see me again? I don't know. Let's see. Hold on. Oh. Okay, can people see me the screen? Can people give me a note saying that now you see my screen again? Can give me a 1? Yes. Okay, give me a 1 again. Eugene, you see the screen again? Sorry about that. Okay, now we go back onto the screen. Okay, sorry about that. I got a little bit technical issue. Okay. Yeah, okay, good. Sorry about that. Okay, now let me go back to the message. I found a lot of people actually they went to see the doctor. I even asked the doctor, I said, why a lot of the people that I spoke to and your patient, if they're pre-diabetic, you really have nothing much to do with them except tell them not to eat sweet. And the doctor was telling me when they come in, they see them mainly for usually start out with hypertension. They also come in for high cholesterol, and so they take a blood test and they start realizing they are also diabetes. So net result of that, they after notify them, they start realizing, wow, now I'm pre-diabetic, or they are already diabetes. So net result, if they're pre-diabetic, there's really no medication for them except just to say, okay, you need to control your diet, not to eat sweet. But that message doesn't go inside the brain, and that little bit motivation for them to really do things. So net result, very important. You really to do things to change your lifestyle. But one of the things that Lowsutea can really help, and that's why a lot of my pre-diabetic friends now love Lowsutea because it actually lower their blood sugar. So their A1C, which the doctor will measure, will be somewhere in the neighborhood 5.5, 5.6, all the way to 6.4. And during this range with the Lowsutea drinking, their blood sugar will go back down to like 6 or 5.8 or 9. So they're continue to maintain at the pre-diabetic state. And so net result of that, they will maybe never convert to diabetes. That will be really good. It help them to start changing lifestyle, understand what is diabetes, and so they start preventing it by adding like exercise, weight control, and so forth.嗱，所以其實咧好多糖友咧同我傾啊，或者前期患病者嘅糖友同我傾，佢話醫生咧自己話俾我就嚟糖尿病啦，我食唔到甜嘢啊咁但係你聽咧，呢個係一個好特別嘅 message，因為好多醫生都話咧，喂你唔係糖尿病，我冇藥俾你食嘅喎，咁你只係自己控制啦，咁你自己控制，不如唔好食咁多甜嘢啦。但係呢個 message 咧，唔好食咁多甜嘢，好多人都唔 understand 嘅。咁只係咧，其實有一個糖友就話：我真係希望我3年前識你得啦，因為佢3年前已經 convert 咗啊。原來個 study 咧係28%啲糖友咧係多數會轉咗去做係有前期患病者嘅糖尿病病者嘅。咁變咗嚟講，好重要真係咧，你唔係唔可以食好多甜嘢，其實要諗下咩去糖茶啦，就幫助你咧將你嘅糖咧繼續降低。能夠令到你 A1C 咧 between 5.7至6.4之間咧，咁你繼續係將呢個 A1C 降低咧，咁你就以後咧都唔會可能啦，唔會變咗糖友，或者你係 delay 你嘅糖友嘅 conversion 咧，係可能10至20年後，哇咁都好大分別㗎啦，因為你個身體又健康咗好多啦，唔會影響你個真係血管嘅問題啦，咁你個身體健康晒嘅時候咧。同埋，當你做咗飲咗好多呢個去糖茶之後咧，你做一樣嘢咧係個去糖茶繼續去排毒啊。 咁好多人現在咧，其實我依家亦都收到好多新嘅資料咧，好多女士飲咗咧，佢面咧暗瘡少咗啊，咁好鬼正喎，佢暗瘡少咗，原來真係排毒。有個老闆公話俾你聽，佢嗰陣時啲尿好壓嘅，佢話依家啲尿唔壓，好清，全部都係冇顏色嘅，同埋佢覺得咧個人成個乾淨咗。咁呢啲咧全部咧係幫助你，第一去糖，降低血糖；第二你改變咗生活習慣，咁你就繼續係低糖嘅生活啦。第三排毒，將你所有排。第四仲有一樣嘢，好多人唔知道咧，原來去糖就係仲有降低你 cholesterol 啊 ，LDL 啊，對心臟病嗰個 cholesterol 啊。So all that 咧係會真係幫助你。So a lot of people come back to me and say, wow, after I drink Lowsutea, is really one more thing is very interesting. One, I get cleaner because the urine becomes very clear, no really big smell. And secondly is when you go to the doctor, the A1C actually went down. A lot of them is actually went down to 5.9, 5.6, those ranges. And then, and some even went to, many of them are between 5, 6, 7 to 6.1 around that range, drop down. But on the other hand, they also realize the LDL cholesterol also go down. Matter of fact, so they don't even need to end up taking the LDL medication, cholesterol medication. So they are very much happy. Also, one more thing, the detox function, the face, they also lessen pimples. I have a lot of so-called 50 years old clients call me back and say, wow, your Lowsutea is very interesting. It actually lowered my pimple. So this is some of the thing that, you might want to realize that it can do real well for you. Now, how Lowsutea works is very simple. As you know, you can see this. You have a pancreas here. What sugar go into your stomach, like food, it will convert to sugar, and then eventually got into the gut. And the guava leaves, there are two items in there, the guava leaves and bitter melon. Guava leaf blocking the sugar going to the vessels, and then you have less sugar in the vessels, and the bitter melon is act like insulin that help the sugar go into the cell. As you know, when you get diabetes, one of the things that will affect you is your insulin, and the pancreas will not come up with enough insulin for you. So that is the major problem that many of the people don't realize. Now, bitter melon actually act like an insulin go inside the cell. So net result, you have less sugar in the vessels. And that's how it works, okay? Now, then let's talk a little bit, about today really important topics. Now, as you know, a lot of people don't realize stress is not good for diabetic, okay? Stress is not good for diabetic or pre-diabetic, because what happened is your body will respond to stress, and it actually increases sugar because they want to make sure ready for war, run, or whatever. So actually, it really gives you a very much potential to increase the risk of diabetic complication. And what's that mean? Okay, so when you, for example, I have a lot of patients call me now. 其實咧仲好特別咧，原來你當你係糖友或者前期患病者糖友咧，其實你係唔可以有太多壓力嘅。當你有壓力嘅時候咧，你係會嗰啲糖會升翻上嚟嘅。因為升翻上嚟嘅原因咧，就係因為佢準備你打仗，咁俾啲糖你，但係你又唔夠胰島素帶啲糖入細胞咯，咁你好多糖喺個身體游落去咧，咁啊變咗咧就令到你個機會咧有併發症咧係高嘅 ，OK？ 咁其實咧好重要咧就係我哋嘅前期患病者或者糖尿患病者咧，現在嚟講好多人咧都開始有好多掛心啊！咁咩掛心咧？嗱，其一好多第一個就好驚咧，就話哇，我唔會中咗呢個 COVID-19 呢個新冠狀病毒嘅感染啊，我會病啊咁。咁呢個咧係好多糖友都打電話俾我，同我傾下呢樣嘢嘅。So many of my pre-diabetic and diabetic clients are worried about, wow, there are so many people out there potential got infected sickness with COVID, and would I be a person to get COVID-19? And a lot of people have called and really worry about that. And so that is create a stress. Now with this stress, internally in the body will continue telling you, wow, hey, you know, you gotta be somehow you're ready for fight. So they will pump up more you stress, more sugar is going to come out from your body, from the liver, from everywhere, because they need to get you ready for the ready for war, so to speak. So your sugar will go up. And another thing too, a lot of diabetic and pre-diabetic person, and they realize their blood sugar goes up also, and also their would it be cause me more problem, complication? So in their mind, they said, wow, you know, as my blood sugar is really going up, all these worries are coming to them. And that will actually also move the sugars up. Now, with today and economy, even worse, a lot of people might think that I might lose my job or lose my job. I don't know when it's going to happen. So many of these people, again, this is additional stress. 好多糖友咧打電話俾我咧，佢哋好驚話，哇，仲有一樣嘢喎，我血糖成日高，我搞唔到血糖低嘅，唔知點解醫生媽話你可以加藥俾你咯喎，咁佢哋就整下越整咧就可以驚啦，驚嘅時候咧就會又可以將血糖整高啦，咁仲更加差咧，依家工作環境啦，各位都知道啦。原來咧你可以冇工作嘅喎，咁好多人又話死啦，我第二點知有冇工做啊？咁呢啲又係另外一個環節出嚟咧，令到你咧會擔心好多嘢。咁如果你血糖高嘅人，或者你係一個前期患者嘅人咧，弊家伙啦，你就會 end up 咧係會有繼續呢啲咁嘅問題出現，咁令到你咧又會係繼續咧係會加多一啲壓力。咁同埋仲有咧一個咧就係、有啲人就話：哇！如果我病咗，我點 take care 我啲家人咧？同埋仲有出去又要戴口罩，哇！好煩啊！要戴口罩又要同人距離啊！咁同埋仲有人，喂，嗰個COVID-19 幾時完咧？呢個疫情係幾時完咧？咁啊點樣咧 ？So a lot of people are really why in the mind is all stressful because besides they have potential to lose a job. And also they will say, if I'm sick, I cannot take care of my family because many people say when I'm sick, I might have to go quarantine 14 days. Or if I go to hospital, I will stay there for months. So who will take care of my family? So all these are adding on to the mind and keep thinking about until stress coming out. One more thing is you have to wear masks, social distance all the time. And a lot of people say, I'm tired of wearing masks already. So net result, again, another thing coming around. So also one more people will say, wow, when is the pandemic getting end? Because it seems like it's endless. And so all these add up, unknown are coming into mind and they will be all worried, okay? So all these stress are increasing a hormone called cortisol. And cortisol is a hormone that will continue increase and it will add on sugar into your bloodstream, and that result you will actually there was sugar and fat will add on. So net result that will not create any goodness for you as a pre-diabetic or diabetic, because as you remember, once your your sugar going up, it affects your entire body. So that you have to be very, very careful. And so client, when they are doing with this stress, the cortisol as a hormone can pump out sugar and also fat to protect you for saying ready for war. OK 嗱，其實咧，如果你係記住啊，當你有 stress 嘅時候咧，你個身體咧就會繼續咧 pump up 一個叫做 cortisol 嘅荷爾蒙出嚟。咁呢個荷爾蒙咧就會繼續係幫個身體咧去揾多啲糖出嚟啦，同揾多呢個 fat 出嚟啦，因為佢增加脂肪同埋糖咧，就能夠準備你打仗。咁呢個兩樣嘢咧就唔係好嘅，因為當你依家要糖係要降低，唔係增加喎。咁所以變咗，如果有 cortisol 咧，你就血管裏面會增加糖嘅。咁樣啦，當你有壓力嘅時候，你估你有咩問題仲有發生咧？仲有一個問題發生，當你壓力嘅時候咧，你係會食多啲嘢嘅。我唔知你知唔知道啦？當你係哇死啦，我好驚，或者你有啲好重要嘅情節要馬去做嘅時候咧，你會攞好多 snack 食，好多人就食 chips 啊，有可能食朱古力啊，有可能食餅乾啊。So 呢啲嘢咧，全部係壓力嘅時候咧，你會食多啲嘢嘅。Okay. So also, I don't know you. I'm sure you all experience this. When you are stressed, you know what you're gonna do? You want to eat more. You're gonna start eating snacks like peanuts. You're gonna snack eating chips. You have to eat some cookies, and all those things actually keep coming in your mouth. And because you are stressed, or you start, really looking for this food to eat to just satisfy the stress. So all of them, people are experiencing that. So both items is actually no good for you. So as you know, I just want to go through real quick. Everybody already know, if you are really high blood sugar, it really affects your heart. So you can might potential heart attack. You affect your vision. Matter of fact, several clients actually call me already, said, hey, can you recommend a doctor for me? Because I'm only a 3-year diabetic, but eyes are getting blurred. So again, this is one item you will have coming up. And we're going to have a lecture sometime in December. I will tell you later. We'll talk about diabetic reflect your eye. And then one more item is really go serious. A lot of people have kidney disease because of the fact that it affected kidney. So quite a few people call me, hey, my kidney now only 30 or 40%. If you have 20% of your kidney, you know what? You're going to start getting dialysis. So that is going to be really, can be a real problem. So you have stroke and also nerve damage. Now, nerve damage is also very serious because your leg pain, you can feel it. And a lot of other problems come around will be causing that. And that might not be good for you. And on top of that, especially people with 10, 15 years diabetes, that will be a real issue. And then the poor circulation. As you know, if you get injured and net result, you're going to cut out your foot. 嗱，記住，其實血糖高咧，真係對全身體都冇，因為話識所有血糖都係 affect 咗你整體嘅血管噶嘛。咁首先你心臟病有個問題啦，你眼有個問題啦。眼依家好多朋友咧話俾你，我眼開始蒙喎，3、4年已經係咁喎，哇冇比係咪？咁仲有咧，你 kidney 有問題啦，咁仲有中風啦。嗱 kidney 咧就好多人咧係現在香港咧75% 嘅糖友。去打啦，即係洗腎嘅糖友，75%糖尿病患者嚟嘅。咁有中風啦，仲有神經損壞啦。咁其實咧，如果你係尤其是10至15年嘅糖友咧，呢個係情況係會高嘅。嗱，呢個高情況咧，仲有一樣嘢，50歲以後咧，30% 嘅糖友男糖友啊。係影響到做咩啊？性生活啊，所以呢個其實係一個好大嘅問題，好多人唔知嘅。咁所以你一定重視啊。咁仲有個 poor circulation 啦，你血液循環唔到咧，個 lower 腳嗰度咧就會變咗咧，就咩啊？整酸咗啦，咁你唔好啦，咁就割咗個腳啦。咁嗰陣時我醫好多病人都係會有呢個問題嘅。咁嗱，第一啦，原來咧喺美國啊，75% 嘅大人咧。係有每一個月都有一個跡狀咧，係會有呢個壓力嘅跡狀嘅。Okay, really so severe. Didn't realize 75% of U.S. adults will experience one stress symptom each month. 75% adult. Now, what does that mean? 嗱，記住，因為如果你係有一個有壓力嘅跡象，咁佢哋壓力跡象係多數有咩咧？嗱，好多時咧你就會唔記得嘢開始。第二咧，你唔能夠專心，你做一樣，哇死啦！我唔知點啦。咁同埋咧，你會瞓唔到覺。嗱，其實好多朋友都話俾你，我瞓唔到覺啊，因為原來好 stress。咁我要俾啲教佢點唔好咁 stress 啦。同埋個 mood swing 好緊要啊！你 stress 嘅時候，你會繼續鬧多啲人嘅喎。咁同埋咧，你會好多焦慮嘅時候，話死啦，我唔知幾時死啦，或者唔知幾時病啦。同埋可能搞到好差嘅時候咧，冇胃口，仲要咧好多人咧會 end up 喺自己我唔出街啊，我 isolate 自己啊，咩嘢都唔去啦。咁仲有咧又咬手指甲啦，或者可以食好多嘢啦，繼續咧，因為呢啲係全部係神經嘅反應嘅。So the stress is such a big problem. 7% is a big problem. So a lot of people will ask, well, okay, what will be the stress symptom is going to be for typical Americans or Hong Kong people? One is very interesting. You start losing your memory. So you start forgot, because you're stressed, you start forget not only names, activities, you're so stressed. That's why it's important sometimes you have to write things down. And you cannot concentrate. You are stressed, you will say, I will do this, I will do this, I will do this. More you do that, more you mixed up, you will continue to be stressed and getting lost, okay? And that is happen all the time. One more thing that will affect you and stress, you cannot sleep. And I have a lot of clients call me, Andrew, I can't sleep. And they're asking for solution. And really sad, I see them, they are very good people, but they cannot sleep, seriously. They're having a lot of problems sleeping. And also another thing too is, besides having problems sleeping, they feel like they are stressed out, but they really don't know what to do. And they really have no idea what to do. So they cannot sleep. That will be a common thing that a lot of people will, have worried. They will have that problem. And then you have mood swing. Now, mood swing is another one. You will start getting very frustrated easily because you are stressed. One of the mood swing that a lot of people will do, they will start scolding people. They will start getting, wow, man, or they will yelling at people very easily. So these are the kind of thing that many of these people will experience with mood swing as one of the very important sign and symptom. Another thing, you have very anxious thought. You will dream up all the negative thing coming around the corner. You will say that, I'm going to get COVID-19. I will get this. I will get that. So you will start getting all this feeling. And then with that, you will start getting a lot of negative idea, negative mood. It will affect your appetite. So you're going to start losing your appetite. You don't feel like eating. And then eventually you will isolate yourself. Now, that is one of the most difficult and most not good things for you to have, isolating yourself. I just have a few clients, they were so scared of COVID-19, they actually isolate themselves, haven't gone out for weeks. I'm talking about weeks, not 1 week, 2 weeks, 3 or 4 weeks. So net result, they isolated with all public. Now, with that, when they isolate so much, they continue to get more and more scared, more and more depressed. And so net result, I would tell them that, hey, call your friends, call a relative. If you worry, tell them come visit you. So get them to slowly open themselves up. So you got to really careful on that. And certainly with the symptom is one of the things, you start biting your nail, you start pacing yourself, you start eating a lot. That is a common symptom. You start eating a lot because you are scared and you're stressed. You start eating a lot to satisfy that stress. So these are the common symptoms. Imagine 75% of US adults will experience at least once, and that is a serious problem. Also, stress, another big thing that you really need to watch is they could lead to anxiety and depression. Stress will affect you with, at the end of the day, you don't want to get yourself depressed. And I think that a few of my clients are getting to that part already, and lucky we caught them early. So they're very anxious, but we'll help them to at least talking to friends now. Eventually they start understand, okay, maybe I gotta go out, not to lock myself all the time. Now, when you have anxiety and depression, you know what? You are not gonna be motivated. You're gonna start getting not want to do anything. You don't want to do exercising. You don't want diet. And many of the people actually lead to alcohol and drugs. Okay. 嗱，其實咧，當你好焦慮同埋你開始有憂鬱嘅時候咧，呢個好大問題嚟喎。因為呢啲咧全部咧係能夠令到你咧冇咗成個動力嘅人。咁我所有 exercise 唔會 exercise 咧，我喺屋企啦，瞓喺度得㗎啦。咁其實我見到好多我而家嘅有啲糖友咧，或者前期糖友啦，有呢個問題喎。咁佢如果變咗係全部都唔想做嘢嘅時候咧，佢連食嘢又唔想食啦。咁當然啦，香港或者呢個少啲嘅，喺美國咧好多咧就會變咗飲酒啦，能夠即係醉酒自己嘅算數啦。咁亦都有好多係變咗係去吸毒啦。咁香港或者反而少啲個，但係我哋現在都睇到咧，有啲係去酒方面行嘅喺美國方面。但係我喺我哋個 group 裏邊，好彩咧啲人咧只係話哇我即係好似好攰啊，唔想做嘢啊咁。咁呢啲咧就即係一個。喺壓力上咧，如果你有焦慮咧同憂鬱咧係會產生嘅。咁啊 ，so So really you have to watch, are you really totally anxiety, depression? So you really need to do something. And what is the common symptom of this anxiety and symptom? And usually when you are really anxious, you know what? Your heart is going to start pumping, go pum, 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 pum. And secondly, you will start maybe even dizzy and you're going to start sweating, okay? 嗱，好多好常見嘅症狀咧，當你係有 anxiety 咧，或者呢個焦慮咧同埋憂鬱嘅時候咧，你個心會跳得好快啊，砰砰砰咁跳嘅。咁第二樣嘢你會覺得跳下就會頭暈啦。第三咧，你開始出汗啊，可以飆冷汗啊，你講嚟啊。咁呢啲咧就係好 common 嘅anxious。咁呢個咧你一定要開始自己應該俾啲 tips 你開始做下嘢啦 ，OK？ 咁其實咧最重要第一咧點去能夠管理你自己嘅壓力咧？嗱，第一好重要管理自己壓力咧係要管理個未知數 ，OK？You really have to understand how to manage your stress. First thing you have to know is manage your unknown, because when you're unknown, you start getting a lot of wow, I don't know what's going to happen. Am I going to catch COVID-19? All these things are giving scary thought. So it's unknown. So it's a scary thought. You will start feeling very, very worried, and it will increase your cortisol hormone and increase your blood sugar going up because when you're ready to fight, right? So very important. You have to manage your unknown. 如果你係糖尿患病者或者前期患病者，如果你有咩唔知道嘅時候咧，你會真係製造一啲嘢咧係好驚嘅，因為我唔知啊嘛，我唔知會發生啊嘛，咁你會整好憂慮出嚟嘅。咁憂慮出嚟嘅時候咧，咁你就會有個 cortisol 嗰個荷蒙走出嚟啦，咁令到你血糖會整高嘅。咁第二樣嘢啦，你咧如果有咁嘅情況發生嘅時候咧，咁你要做啲咩咧？首先你要即係攞多啲知識啦。嗱，當然喺 webinar 方面咧，我哋係有一個好大幫助嘅。好多堂友咧話我冇時間睇咗，但係我都翻去睇翻你個 webinar。咁睇翻嗰啲 webinar 咧，對佢哋真係能夠令到佢哋知道OK， 原來咧都唔使咁驚嘅。如果戴口罩或者我係同人距離，咁其實咧我都唔會有 COVID-19 嘅。咁真係要參加我哋 Lowsutea， 我哋不嬲依家做嘅webinar 啦。如果你聽唔到嘅話，咁你可以再即係我哋都會寄翻俾你，一個禮拜後寄翻俾你咧。咁你聽翻佢，咁你了解多啲 ，OK？So very important how to get your solution to learn more and listen to our webinar. And so that way you can understand what is happening. Or send me an email or WhatsApp. I can able to give you information. And a lot of actually, I joined to several groups. And a lot of their customer actually come to write to me because they all talk about diet. But I talk about not only diet, I talk about health beyond diet, talk about medical problem. They all know what's going on. So net result, these people will start saying, hey, Andrew is pretty good. I can get some information on that. So I help them to find out the unknown. Now, for example, one of the questions that just recently one of the group asked me, hey, will I become anemic, for example? So actually, if you are taking metformin for over 15 years, anemic can be possible for 30% of metformin patients, okay? So these are kind of things that people really don't know, and there's, oh, wow, how come I become anemic? So you can also talk to your doctor, family doctor to find out. It's very important. You need to really find out and talk to friends, talk to us, and we always love to answer your questions. 所以其實咧唔使驚嘅，因為其實依家我有好多人係嚟幫你嘅。如果有明白打咪俾我咯，或者 WhatsApp 我咯，或者寫個 email 俾我咯。咁其實咧我係可以答你嘅。咁你未必都知道唔怕喎，有咩事揾 Andrew 可能夠有得解釋。咁或者同你個家庭醫生傾下偈啦，因為我自己本身咧係護士啦，IC 護士啦，咁我都可以俾好多 answer 你嘅。如果唔識嘅話，我都揾好多醫生答你都得嘅。咁所以其實咧係唔使驚，好多 support 俾你。咁仲有我哋有個叫 CT Lowsutea Group 啦，咁呢度亦都有好多 information 係幫你嘅。So we also have a CT Lowsutea Group. You can join and you can actually also ask questions and we can answer you anytime. Secondly, actually every day as a pre-diabetic patient and diabetic, you have to be ready to organize yourself, because don't forget, you're diabetic and pre-diabetic. If you're pre-diabetic now, you have to really help yourself to organize in such a plan that when you are diabetic, you have able to have everything ready, so you don't have to have stressful to manage your disease. And so net result, you have two things you always need to manage. One is your diet, and second is medication. Actually, I would say medication first and the diet, okay? So very important, you have to have an organized plan to do that. 嗱，其實咧好重要咧，原來咧你每一個朋友咧，你首先仲要當你係前期患者或者後期已經係糖尿病者咧，你一定要點有個計劃同埋組織管理咗你嘅點樣食藥啦，同埋你嘅 diet， 你嘅每日食嘅計劃。因為如果你唔係咁做咧，你會好多產生日常嘅生活產生，你會又要好驚啦，又話要好多煩嘢啦，咁令到你 stress 繼續高 up 嘅。So how are you going to manage your drugs and your meal? Very important, actually, as a habit, you got to start getting this pill box. And that pill box will have 1 week pill box, and then maybe some pill box you have morning, lunch, and dinner pill box if you have a lot of pill to take. Now, I also have pill box, and I manage it in different color. I have my green one in the morning, blue in the afternoon, and then sort of a reddish color at night. Definitely, you have to manage your pill box in order for you to take your drugs first, because you don't want to miss any of your drugs. So pill box important. And also you can make all your pill line up for 1 whole week. So you only do it once a week. Everything's there. You have to no worry. So all you got to do is just take, hey, did I take this drug? Because pretty soon you're going to forget, especially when you get older. Don't forget, this is a lifelong disease. And you do not organize, eventually this is going to catch up with you, because when you're 70, 80 years old, you have no habit. You did not make the habit. So you might miss your drugs. I saw that, and my father-in-law has the same thing. Now, he lived to 97, but I had helped him to prepare his drug. But before that, when he didn't prepare, he kept missing here and there. My mother-in-law, same thing. They keep missing drugs. When they miss the drugs, that's what? The blood sugar go up, and that's not good for them. So you got to start organizing your pill box. 嗱，其實咧，管理個藥咧係好緊要嘅。咁好多人都唔知道，哇，點解管理藥好緊要咧？原來咧，你每日咧，你個藥咧，因為呢個係 lifelong disease 噶嘛，咁你嗰啲藥咧，全部都係會點樣啊？係要以後都係由依家，可能依家食一路食，或者食少啲食多啲，你都唔知道 all the way。你70歲、80歲係咁啊！咁其實咧，我個外母外父咧都係有同一問題，外母話真係糖尿病患者嚟嘅，亦都咁好多時見佢咧，如果你冇管理個藥咧，佢真係唔記得咗喎。尤其是到老嘅時候咧，佢唔記得，個腦係唔記得嘅，記住。So 當你唔記得嘅時候咧，你就弊家伙啦。真係嗰陣時咧，好多時咧唔記得晒啲嘢咧，就真係藥，咁你就可以 miss 啲藥啦。所以一個 pill box。紅或者我嘅 pill box 係綠色朝頭早，藍色晏晝，紅色夜晚。咁咧係1個禮拜做一次嘅，咁你就好舒服啦，唔使管理，你係只係睇嘅。我有冇食藥啊？今日星期3我睇到冇食藥喎，咁啊弊，咁你即刻食翻。OK， 呢個係好重要嘅。咁仲有一個咧，第二樣嘢啦，你要管理成個禮拜食咩咧？咁最好咧就已經有個計劃。你唔使嗰日諗，我今日食咩啊，聽日食咩啊？咁你已經整好咗之後咧，咁你個計劃性食嘢嘅時候咧，就令到你個整體個食嘢係容易控制，容易好搞。咁所以變咗咧係好重要嘅。So you have to plan also your meal in a whole week. You may plan maybe 2 to 3 days or 4 days in one time, or sometimes people plan a week. So you don't have to plan day by day, because plan day is so much thing to do. You might become very stressful. So don't do that. Just plan for 2 to 3 days, and then plan for the whole week, what to eat, and write down what carb is, so you can able to have an idea. 嗱，其實咧個 planning 咧，食物咧，如果你係 plan 到2、3日或者4日咧，喺個食嘅東西寫埋有個幾多 carb 咧，咁你有呢個計劃嘅時候咧， 你個生活咧就容易好多，冇壓力啦。Now, you also, this is a very important suggestion because I deal with stress and you deal with stress is very different. Now, you and I will have different way of dealing stress, so you have to ask yourself what will be the best way to decrease your stress and how do I approach it, okay? So, you really have to ask yourself. 嗱，好多人咧唔知道咧，原來咧每個人咧去點令到自己嗰個所謂自己嘅壓力降低咧，好多人都唔知道係點去做嘅，或者佢亦都好多人係知道點去做嘅。咁所以佢個方法咧係個個都唔同嘅。所以你要自己問下咧，喂，我係應該點去能夠減低我嘅壓力咧？自己啊，你問你自己。咁譬如你一個講低話我中意行路嘅，我中意運動嘅，我中意買嘢嘅，去睇 shopping mall 嘅，或者中意唱歌嘅，我中意睇電視嘅，或者聽音樂啦，或者我係同我啲朋友或者屋企人傾下偈啦，呢啲係全部我係降低。咁你就 choose 兩三個，咁你繼續去做呢樣嘢 ，OK？ It actually is so important to reduce your stress. You have to ask yourself, how do you unwind? How do you decrease my stress? It's all very much individualized. That's why I want to make sure that everybody have a chance to look at that. So you might want to be walking, you might want to exercise, you might want to walk to the park, you might want to do some shopping, you might want to sing, like go to, just sing in karaoke, whatever. You might want to watch TV, want to read a book, you might want to listen to music, and talking to family and friends, increase the socialization. Actually, increase socialization is so important. A lot of time we tend to be forgot about this, we are stressed, don't know what to do, and you just sort of isolate yourself. That is not the right approach. The best is go call your friend, talk about them, talk about you. Both are sharing your difficulties, and that will relax you. That will decrease your stress. So remember, always talk to your friends or your relative. That is important, okay? Now, one more thing. Remember the palpitation? Pump, 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 pump. Okay? If your heart starts pumping faster, one thing you can do is do some deep breathing exercise, like with your chest and also with your belly going out, okay? So you want to create this stress relief is take 6 times with your deep breathing exercise. That will decrease your stress. So you can do that, or if your heart is start pumping, bum, 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 you can do some deep breathing exercise. If you're able to do every day, approximately about 2 minutes, 6 times, your general stress will go down. 嗱，其實咧好重要嘅，深呼吸咧係幫助你好多，容易咧係幫助你呢個降低你嘅壓力嘅。咁呢個降低壓力咧，其實好簡單嘅，用深呼吸，每日係有6次，每一次大概做2分鐘啦，企起身嚟做。咁你咧用個深呼吸，亦都個肚會大啲嘅。咁呢個咧係一個好嘅 exercise。如果你心係跳得好緊，係砰砰砰砰，亦都做深呼吸，咁就令到你咧個自然咧壓力會開始降低㗎啦。咁啦，第二樣嘢咧，仲有一樣嘢，第5個咧就可能咧你去 meditation 啦，咁你 meditation 咧係亦都減低咗好多壓力嘅。嗱，當然咧好多人就話 meditation 要點做啊？咁其實依家你去Google 咧，去嗰個依家係好多。YouTube 裏邊咧亦都教你係點去做 meditation 嘅。咁呢個咧，因為 meditation 咧係幫助你個腦咧係降低好多唔好嘅嘢幻想啊。咁其實咧會其實係降低咗你個chance 去 depression 嘅。咁其實咧亦都降低你 blood pressure。所以變咗嚟講咧 ，meditation 係好嘅。嗱 ，it's so important if you can able to do meditation。It does lessen your psychological stress and lower a chance of depression, and also lower your diastolic blood pressure. 下壓個下會降低咗個 blood pressure 嘅。咁 this is going to be really good. Now you say I don't know how to do medication. It's okay. Go up to YouTube, has a lot of called meditation lessons you can actually join。咁其實如果你話我唔識嘅，去 YouTube 睇睇，好多係可以教你點樣做 meditation，好簡單嘅好多 meditation。最後啦，呢個重要點嚟嘅。點解重要點咧？因為最後咧，好多人唔知道咧，如果你繼續 stress 唔理佢咧，你會變咗咩啊 ？depression 啊，憂鬱症啊。話呢個弊家伙啦。咁呢個咧，你真係咧，如果繼續落去咧，其實我有幾個堂友咧已經去咗嗰度咧，咁佢真係要睇醫生嘅。咁出嚟睇醫生好咗啦。咁但係咧，我要介紹咗醫生俾佢睇，佢自己先知道，哇！原來我真係唔知道會有憂鬱症喎。因為好多人唔正視咧，原來憂鬱症係一個好大問題，真係可能會食藥啦，或者要俾醫生解釋啦。咁呢個咧係一個好重要嘅問題，要注重睇到。嗱，其實咧喺憂鬱症呢方面咧，一定要係要即係唔係自己醫得到嘅。如果你真係有憂鬱症之後啊，咁你真係要係揾醫生嘅。Very important when you continue to get stressed, you really look for potential you are not depressed. Because if you really become depressed, you really need to get a doctor, a mental health professional to help you to treat this stress. And I do have several, diabetic and pre-diabetic individuals who approach me, and I start realizing, wow, they are really approaching a real depression because they cannot sleep, they lost appetite, they really don't want to feel anything, they were totally isolated. So I have to actually recommend them a doctor to actually help them out, and they have got a medication, and now they got well. This is serious, So you really need to understand that, and to be honest, in diabetic, you have 2 times more chances experience depression, and so because of the fact that your life feels so complicated, you have to take care of medication, your blood, your food intake, you're picking your finger. So many things you have to do. So you worry about you might get worse, I might need to get dialyzed. All that thing will come down to you. And if you do not actually have a good mental health to take care of you, you are going to get bad. And then you become depressed. And so at that time, then you have to get your doctor, you need to get a psychiatrist doctor to help you out. So I do have patients now actually come to see me, and I did recommend them doctor, and they got well. So that's good. 記住，如果係喺呢個糖尿患病者，如果你係有其實我哋有2成啊 ，2 times 係會有 depression 嘅。咁如果因為點解咧？你好多壓力啦，我又驚住弊啦，我唔知係咪會唔妥啊？有不同嘅東西出現啊，好多呢咁咧係會有影響你嘅。咁呢個咧其實咧就要幫助你咧係要睇住你唔會有 depression。因為我有幾個堂友已經係變咗即係 depression。佢有咩 depression 咧 ？For example 啦，佢會第一唔想食嘢啦，成日瞓覺啦，冇晒人生樂趣啦。咁我就話俾你一定要睇醫生喎，因為依家你已經去到呢個 stage 啦，就唔可以。咁同埋咧，佢好弊咧，全部都好 isolate 自己啊，又唔出街啦，食飯又唔食啦，朋友叫佢食飯佢又唔去啦。咁呢啲嘢睇晒出嚟咧，咁你哋咧就真係要咧開始可能要揾個專科嘅醫生睇你啦。咁所以要記住，你係有2成嘅人咧係會變咗 depression 嘅，因為呢啲壓力太大啦，又唔知點樣啊。咁你唔去正視咧，係會對你身體十分唔好嘅。OK， 咁啦。In summary 啦，因為每一次咧，我希望咧聽晒書之後咧，你都有個總結嘅。第一，你要管理點叫未知數。如果你係有糖尿病或者前期患病者，你真係要翻out多啲咩叫糖尿病啦，咩叫前期患病啦，能夠令到你唔會變咗糖尿病啦。呢啲全部嘅未知數你一定要知道嘅。第二樣嘢，你每日要第一要 manage 你嘅藥啦，因為你一定會有好多藥㗎啦，你會有血壓藥啦，有糖尿病嘅藥啦，或者你係有呢個cholesterol 呢個膽固醇藥啦，或者其他藥啦。因為咧，我知道咧，原來糖尿病係一個一世嘅 disease， 咁你一定要點管理先能做到呢樣嘢咧？咁令到壓力降低啊。咁第三咧，你就要問下自己，我點能夠令到我自己係唔會有一個
即係點去能夠我更加令到自己唔會有咁多壓力咧？咁你嘅 approach 咧，你自己嘅方法咧，係同人都好唔同嘅。So in summary, how to manage your stress is so important. Is you have to manage the unknown. If you manage the unknown, at least you decrease your stress because now you know how to approach it, how to fix it. And you have to organize the diet plan medication. Now that's important because diabetes is a lifelong disease and you have to manage the medication first and then the diet every day. And it will be lifelong. And you have to ask yourself how the best I can approach my stress. You could be like to read, you could like to be watching TV, whatever you do, you have to ask yourself and take several ways and so you can keep doing it. 咁第四咧，我要做啲叫深呼吸嘅運動啦，就每日做2分鐘6次。咁如果你心跳得好快嘅時候咧，應該做下佢。咁仲有咧就可以能夠做 meditation 啦。咁如果你唔識做咧，去 YouTube 有好多教你 meditation 嘅，會幫助你。最後好重要咧就 watch for 你真係有憂鬱症。如果你憂鬱症咧，你係要揾醫生去幫你嘅，唔係自己做到嘅。咁呢個咧係一個好重要。咁多數憂鬱症嘅人咧就係冇咗人生有趣啊，唔想喐啊，成日瞓覺啊，又唔食嘢啊，喺屋企韞喺度啊。咁呢個就係呢個係一個好開始嘅 sign 係有 depression 咧，你一定好快正視嘅。So last but not least, you have to do some deep breathing exercise 2 minutes 6 times a day. So you can do that. If you have palpitation, do some deep breathing right away. It will relax you. And you have to think about meditation. And last but not least, you have to watch for potential depression. Okay, so this is good. And now I'm going to go into how to show you how to make chocolate shuffle. Now, what is shuffle? The reason why it's not waffle, because we're not doing this with, Eugene, I will answer your question after we watch the video because you said you are not sure how to watch for potential depression. I will answer your question after we watch the video. I think those are very good questions, Eugene. Thank you for asking. So anyway, I'm going to start showing you this video, and basically it's very simple, and you will see the ingredient is extremely simple and it's very delicious. Okay, so I'm going to do that. I'm going to put my video on and then we'll go from there. So 我今日咧做一個叫朱古力嘅shuffle. Okay, today we're going to make chocolate shuffle. Now the chocolate shuffle is really unique because it's only 2 gram carbs, easy to make, and it's so delicious for your breakfast. Now previously, we are made like almond bread, we have made chocolate cake, we have made cinnamon powder balls, and we have made ice cream. And now today we want to make a breakfast item for you. Is only 2 gram carb, so you can enjoy your breakfast, enjoy your really interesting life instead of everything I cannot eat, you cannot eat that. But this is going to be very delicious. 嗱，嗰陣時咧，我哋做過咩啊？我哋做過杏仁麵包啦，又做過朱古力蛋糕啦，又做過肉桂球啦，咁亦都做過雪糕喎。嗱，今次我哋做呢個咧，點解做 shuffle 咧？就係因為咧，好多人就話喂，我哋呢幾多朝頭早有咩食可以食啊？好多嘢食唔到喎，唔緊要，呢個就可以俾你食到，係2克嘅碳水化合物，同埋咧仲有。可以咧有朱古力味嘅，哇！真係一流。OK， 咁我依家去做呢樣嘢啦，好簡單。嗱，我講所有嘅嘢喺裏邊先。第一，呢度咧係有2安士或者56 gram 56克嘅cream cheese，OK， 然後咧再加4個 tablespoon 嘅杏仁粉，2隻雞蛋，睇唔到？然後咧就有2個 tablespoon 嘅unsweetened 嘅cocoa，OK， 即係朱古力粉啦。咁然後咧就1個 tablespoon 嘅 stevia，OK。咁呢個就 ingredient 嘅。So I'm going to repeat the ingredient one more time first. so everybody know. And I will actually written down for you. Don't worry. So first, we have 2 ounces or 56 grams of cream cheese. And then following with actually 4 tablespoons of almond flour. And then after that, you have 2 eggs. 2 eggs put in a, just take off the egg and take the yolk and egg right here. And then after that, you have 2 tablespoons of unsweetened cocoa. And then 1 tablespoon of stevia. So very easy to do. And so after this, all we do is just put everything in this mixer, and then we'll just mix it up, and eventually we'll just pour into here. Okay, pour into your waffle making machine. Now, before you do the waffle making machine, also I'll do some spray. I use extra virgin olive oil spray to spray the waffle machine, and also has to preheat. So first of all, I'm going to start mixing the item first. Okay. So I put everything here. I put my spatula. I put my sour cream in here. My cream cheese, not sour cream. Cream cheese. My cream cheese in here. Sorry. And then next, I put my almond flour. It's very easy to make. And then I put my eggs in here. And everything you do, everything finished is totally 2 grams. And then we have 2 tablespoons of unsweetened cocoa. Okay, I will put it here. Okay, and then 1 tablespoon of stevia. 1 tablespoon of stevia. Okay. 咁啊 mix 晒佢先，咁啊要繼續 mix 咯 ，OK? Very easy. See what I'm doing? So I mix. So now I'm gonna take some time to mix. So maybe I turn off the camera first, and then you don't have to wait. And then we use this thing to mix it and make it easier for everybody. I use my mixer here, so you don't have to wait. Okay. So give me a couple of minutes to mix this. So I'll come right back, okay? Hi, I'm back. By the way, I'm just keep mixing. It's take about 2 to 3 minutes. So mix after that, look something like that. You can see it's all kind of liquidy. I'll take it out, and you can see all the cheese are mixed together. 嗱，我其實咧 mix 咗大概咧2分鐘到啦。咁2分至3分鐘啦，咁睇下你 mix 幾多 mix 下就差唔多全部變走去豬激水咁嘅 ，OK 睇到啊？咁依家咧，我哋首先咧就將我哋個oven 咧就preheat 咗佢，咁然後咧就我呢個 oven 已經 preheat 咗啦。So you really have to preheat this, the so-called the waffle oven here. So waffle maker, actually oven, just waffle maker. So the light turned green, that means preheat. Okay, I also have sprayed already. So I'm gonna put it inside here, and then let's put this in, and you can see just fill up the level all the way through. Okay, and that's good. And then we'll go this way. Same thing. I make totally about 2 pancakes. Okay, 2 shuffle. Okay, good, excellent. So now I'm going to cover it up, and then we'll let it go, and then see how it goes. Wow, I'm back. You know what? It's right there in 5 minutes. So we're going to stop the clock, 5 minutes, and then we'll see how it look like. Okay? So take a look. Wow, look at that. It's a nice, really waffles, shuffles, okay? So let's take one of them out, and then we'll see how it tastes like, okay? I'll take one of them out. Oh, so easy to take it out. You see how nice? I'm gonna leave one here, and I can also 嗱，我哋已經焗咗5分鐘啦。5分鐘之後咧，就做咗一個 shuffle 出嚟，就係 有雞蛋同埋 cheese 一齊做嘅。咁現在嚟講，你可以擺牛油啦，或者可以擺啲咩啊 ？blueberry 又好食又夠健康。嗱，我就唔好擺牛油嘅，因為我覺得夠晒好味㗎啦。但係你中意咧，可以擺牛油。咁當然啦，牛油多啲咧，就卡路里又多啲啦，或者你個 carbs 高啲啦。如果依家咁咧，就啱啱2 carb 嘅。咁但係如果係咁嘅話咧，我哋亦都可以咧係加啲，譬如你話有啲其他嘅有啲人咧就加些少 jam 啦，但係亦都會加多咗啲卡路里。So 加多啲 carbs 啦。So a lot of people actually like to eat it with just only butter or no butter, and itself is already tasty. You don't need to have the butter. And on top of that, you can put some fruits. You can put strawberry. You can also put blueberry, and berry is extremely good for you. And that result, all that together is just 2 or 1 more carbs up is so healthy. And on top of that, you can truly enjoy a wonderful breakfast with that. So you can take a look. You can see how nice it is. Yeah, I can show you. Yeah, very good. Okay, take a look. All right, now let's open this up and take a look. Does it taste good? I'm gonna take a look in here. That's how it look like inside. Okay, it's actually a chocolate inside. You take a look. It's very good. Oh, it's delicious. Now, a lot of people say, wow, hey, does it look like burnt cheese and burnt egg? It's not. I can tell you that. This tastes like really like typical, almost like waffle, but this is shuffles. It's egg and cheese. So, take like that, and then I will take one and take a look how it look like and taste. 試下好唔好味先啊？It's delicious. 真係一啲唔似咧，係用雞蛋芝士做嘅。So it's very, very delicious. You can see inside how it look like. You see? It's really good. If you have a little bit, put a little bit raspberry there and with the strawberry there, wow, it's so wonderful. It's really good. So this is a wonderful, truly a wonderful, great breakfast item, and you make 2 shuffles, and you're really gonna start off you a nice, wonderful day. So enjoy your breakfast, good recipe, and you have a wonderful life. 2 carbs, and is great for your diabetic control. Enjoy. See you next time.
Okay, now I'm come back. Now I'm going to answer. Let's see. Can everybody hear me? Can you give me a 1? Can you give me a 1 if you hear me? You can hear. Okay, good. All right. Thank you. The thing is this, this is going to be real good, and you can try with your family because you don't need to be a diabetic to do that. Actually, all my family tried it and said, wow, this is real good. I don't even need to have a, try it, and they love it. So keep that in mind. You do not need to, you can actually enjoy this, and it's only 2 carbs, so it's really good. Now, let me add, 大家其實咧呢個 recipe 咧好正㗎，你唔使一定係糖尿病食得嘅，亦都前患者有冇問題嘅，因為我屋企咧俾好多人咧，亦都佢哋冇糖尿病咧食咗之後，哇好正喎，仲好過食個普通嘅 waffle 喎。So you can share it anybody, and it's so easy to make. OK， 嗱咁另外一個咧就係、有個問題咧就係 Eugene 嘅問題啊。Eugene has asked, they're not sure if you need to, I think the question that Eugene asked, if you're not sure you would be watching for potential depression, I guess we need to watch each other. It is actually very true. You really have to watch your friends and relatives, are they getting depressed? And it could be your wife, it could be your children, because the people who got identified and called me was not because of the individual, was their children calling me, or their husband calling me, or the sister calling me. So net result, you got to understand all these things is because they start realizing, wow, you know, I have problems. So it's not really the person who depressed call. Matter of fact, majority of people who are depressed, they don't call. The reason is because they're depressed. They were not looking for themselves. They will not watch out for themselves. So net result, you will not get that. So keep that in mind. Make sure, you know, you got to keep that in mind that if you have a depressed person, they might not call you. I mean, they will not let you know they are depressed. So the family have to watch. 嗱，好記得啊，記住啊，好多人真係 depressed 嘅時候咧，佢未必係會自己去揾答案嘅。多數嘅人咧係點樣咧？就係佢屋企人啦。其實多數我依家病人揾我啲，唔係個病人揾我嘅，係佢嘅屋企人，好似個仔啊、佢個女啦，或者佢個先生啦，或者佢個妹啦。咁打電話俾我同我傾咗之後，我先話俾你啊，咁呢個可能你係即係開始有 depress 喎，要揾醫生喎。咁呢啲全部唔係個病人本身啊病。咁亦都有啲前期未到嘅時間咧，佢會打電話俾我就話：喂，我唔瞓得覺喎，好多日都冇瞓覺喎。嗱，咁嗰度好啲嘅。但係如果佢真係開始 depress 咧，多數唔係點做嘢。OK， 記住呢樣嘢先嚇。Okay, so I hope I answer Eugene questions. If they are potential depressed, what do they do? You have to watch each other. Seriously, you gotta watch each other. Okay. Are there any other questions? Let's see. Okay. Some of the people said looks real delicious. It's for 2 cups, right? One of the waffle or shuffle we call, not waffle. It is 2 cups, okay? 2 cups of one of those, okay? Now, certainly if you add on like peanut butter, add on fruits, add on other things, will increase the carbs, okay? So, matter of fact, if you use you know, syrup, is definitely even more carbs. So that's why I don't eat syrup. I don't put butter. And it already tastes very good. So don't have to do that. That would be wonderful. Let me look at any more questions on this end. Let's see. Okay, good. I think I have answered all the questions. Any other question you have? If you have, you can ask some more questions. If not, I will, you know, thank you very much on your wonderful, busy Sunday. Still listen to the webinar, and thank you for people from Hawaii. Thank you people for, you know, from Hong Kong, Singapore. I have all kind of people that come from different places. Some of them from Australia. I know the timing is very different. I do appreciate the time that they come to participate. 好多謝各位朋友，因為今日係星期日，香港啦，喺美國係星期六啦，咁好多朋友咧喺佢繁忙嘅時間裏邊咧，都participate呢個我哋嘅講座啦，我有新加坡啦，多謝新加坡朋友啦，亦都多謝係香港嘅朋友啦，多謝夏威夷朋友、澳洲朋友啦。Thank you very much to all the people from all different places in the world. I know there are more people coming in because I heard that now. I understand some of them are from Philippines also. So I appreciate all your participation. I love you guys and hope that we'll continue to get more, you know, participate, learn more. And I will also send you folks the replay next week around Friday, Saturday time. Okay, take care and have a wonderful weekend. Bye-bye.